You know, millions of people deal with chronic knee pain every single day. But what if the cure was already inside you? Seriously, a recent study explored this wild idea. Could your own fat cells actually heal your joints? Let's dive in and see what they found.
I mean, it almost sounds too good to be true, doesn't it? Can we really take something most of us wouldn't mind having a little less of, our body fat, and use it to rebuild our aching knees? Well, that is exactly the provocative question that scientists recently set out to answer.
But okay, before we get to the potential cure, we really need to understand the problem, because for so many people, this isn't just a minor annoyance. Knee pain is a daily, grinding battle.
And the main culprit, a lot of the time, is a condition called osteoarthritis. The easiest way to think about it is this. Picture the smooth cartilage in your knee as the soft cushioning in a brand new pair of running shoes. Over time, that cushioning just wears down, and when it gets too thin, you start to get bone grinding on bone. And that is what causes the pain, the inflammation, and a serious loss of mobility.
So this is about so much more than just a sore knee. Osteoarthritis can literally steal your ability to do the simple things like go for a walk, play with your grandkids, or even just climb a flight of stairs. It's a thief that robs people of their mobility and fundamentally changes their quality of life.
So with a problem this big, you can imagine that the search for a real solution is pretty much constant. And that search has led researchers to a really innovative idea, using the body's own building blocks to try and heal itself.
Okay, get ready for the scientific name. Autologous microfragmented adipose tissue. Yeah, it is a mouthful, but it's actually pretty simple when you break it down. Autologous just means it comes from you, from your own body. And adipose tissue is just the medical term for fat. So the whole idea is that hidden inside our fat are these special cells that might have the potential to reduce inflammation and maybe even help repair damaged tissue.
So how does it actually work? Well, it's a three-step process. First, they remove a small amount of fat, kind of like a mini liposuction. Second, that fat gets put through a special machine that washes and breaks it down, concentrating those potentially regenerative cells. And finally, that processed tissue is injected right back into the patient's painful knee. The hope is that these cells will get to work, healing the joint from the inside out.
Now, that sounds incredibly promising. But in medicine, hope and a good story just aren't enough. An idea, no matter how compelling it seems, has to survive the gauntlet of rigorous scientific testing.
And this brings us to the most important question of all. When you're in pain, you desperately want to feel better. So how can scientists possibly separate a real biological effect from the powerful influence of simply believing a treatment is going to work?
Well, they do it with the gold standard of medical evidence, a blinded, randomized, controlled trial. Now, it sounds complex, but this method is the single most powerful tool we have to figure out if a new treatment is the real deal, or if it's just hype.
Think of it like a blind taste test, but for medicine. The researchers took a group of patients and randomly split them in two. One group got the real fat cell injection. The other group got an injection of simple salt water, a placebo. And here is the crucial part. Nobody, not the patients and not even the doctors giving the injections, knew who was getting which treatment. This blinding is what removes all the bias and wishful thinking from the equation.
So, everyone was treated, and then the researchers just waited. They tracked all the patients for 2 full years, measuring their pain, their mobility, and their overall knee function. And when they finally unblinded the results and looked at the data, well, the verdict was genuinely surprising.
The conclusion, pulled directly from the published study, was pretty stunning. After 2 years, the high-tech fat cell treatment was not superior to a placebo. In other words, it performed no better than a simple injection of salt water.
The numbers really tell the whole story here. On a standard scale measuring how much patients improved, the group that got the real fat tissue injection improved by an average of 27 points. And the group that got simple salt water, they improved by 26 points. I mean, that difference is statistically meaningless. It's basically a tie.
Okay, so this is where things get really interesting. Because this result isn't a failure. It's actually a profound lesson. It helps us understand what's really going on when we talk about healing and pain relief.
But wait a minute. Looking back at those results, both groups did get significantly better. Their pain went down and their mobility improved. So if the special fat cell treatment wasn't responsible, what was?
The answer is one of the most powerful and mysterious forces in all of medicine, the placebo effect. And let's be really clear, this isn't about patients making it up or imagining it. The placebo effect is a real, measurable, physiological change in the body, triggered simply by the belief, the hope, and the ritual of receiving a treatment.
So what are the big lessons from this whole journey? First, it shows us that even the most compelling ideas have to be backed up by hard evidence. Second, it proves the placebo effect is an incredibly powerful force. Our belief can create real change. And ultimately, it highlights exactly why these controlled trials are so vital. They're the only way to find out what truly works. And in this case, the verdict was clear. This specific fat cell procedure was no better than salt water.
And that leaves us with a final thought. We all want to believe in the next breakthrough, the next miracle cure. This study doesn't diminish that hope, but it does arm us with a critical tool. The understanding that robust, unbiased science is the only true compass we have to navigate the often blurry line between real hope and just hype.